Welcome back to HU16's Live at 5. Jackson Duncan here with Rhonda Davis, the Director of Student Health Services at Harding. Mrs. Rhonda, thank you for joining us.
Sure, I'm glad to be here, Jackson.
Yes, ma'am. So flu season is upon us here in Arkansas, and just tell us a little bit more about that.
Well, as we know, flu season starts in the fall, and it gets here a little sooner than we're often prepared for. The CDC really drives the vaccination process and recommendations, and they do recommend starting vaccination on October the 1st, which was just this week.
And have there been any reported cases that you've seen yet of the flu here in our area?
There have been. Statewide there are some, and here locally we have had some. So it's not too early to get vaccination. It takes about 2 weeks for a vaccine to develop immunity in someone, so now's the time.
And in the future, what weeks or months should we expect the heaviest portion of the flu to be present?
You know, I know that the CDC would love to have that ability to predict that information. Typically, we see volumes rise in November and through February, but we have seen seasons where the peak will be early or late or extended. And so there's really not a great way to predict that. The blend of vaccine that they choose is driven by what strains of flu virus they see in active screening during the season, and so that's how they develop the next vaccine, and that's really the best way to protect yourself.
Okay, and who all can get these flu shots here on campus at the Student Health Services Center?
Okay, well, we do this a couple different ways. For our employees and faculty, the ones that have current Harding insurance and are over 18. So it could be the entire family that could come in if everybody's over 18, or we can cover the covered adults that are over 18 on the Harding plan. And that allows us to just take their insurance information and then we submit that to HR and get the billing done. It's quick and easy for them. There's no out-of-pocket cost. For students or uninsured situations, so students with health insurance would be able to go to somewhere like Walgreens, any pharmacy here locally, a local care provider, so they could get their flu shot there and submit their insurance. We're not able to bill any other insurance, but if students don't have that coverage but they want the flu shot, we can give it to them for $20, which is a great thing, and a lot of our allied health programs do utilize that.
Awesome. And can you talk about the need to get the flu shot?
Right. Well, it's important to remember that, no vaccine is 100% foolproof, but it does reduce your risk of getting the flu by about 60%, which is definitely worth doing. The other thing is you're not just protecting yourself. There are people in the community who are not able to be vaccinated, infants under 6 months old, the very, very elderly or infirm may or may not have conditions that prevent them from that. And so it's important for all of us to limit the flu spread for those around us, not just ourselves.
Mm-hmm. And could you talk about just some common misconceptions in terms of the flu?
Right. Well, you always hear, well, I took the flu shot and then I got the flu. And I would say to those people two things. Number one, it does take 2 weeks for you to develop immunity. So if you've already been exposed to the influenza live virus in the community somehow, there is a possibility that you'll get the flu shot today, develop flu tomorrow, having already been exposed. So sometimes the impression would be then that the flu shot gave me the flu, but it's really just the natural contact process that has caused it. Two, the flu vaccine itself is created with inactivated viruses that are not capable of causing illness. So it's really impossible for a flu shot to give you the flu. It won't, the viruses won't replicate, if that makes sense. And so it's a safe vaccine to get.
Okay, thank you for clearing those things
Sure.
up. And also, how likely is it for the flu to spread, or how can it be spread?
That's a great question. Far too easily is the unfortunate answer. You and I are standing close enough right now. If I had the flu and I sneezed, you'd be down with it. Roommates, suite mates, all of them share enough living space to easily transmit it to each other. Chapel, and a lot of times too, I'd like to just review briefly what the signs of the flu are, because it can be confusing. But the cardinal signs are sudden onset. So you feel fine right now, Jackson, but this evening, if you had 102 fever, that would be sudden onset. It happened very, very quickly. You went from feeling fine to feeling terrible in a hurry. You will have kind of a scratchy throat, a sneeze, a dry cough, body aches, a high fever. And so sometimes we'll have students come to us who've been kind of sneezy or drippy for 3 or 4 days and say, well, I think I have the flu. And that's really probably not the flu if it's carried on for that length of time without that high fever. Those are the cardinal signs.
Okay, thank you. Thank you again for joining us here in the
Sure.
studio. I appreciate your time.